Good morning. This is Dr. Marjan Assefi. Today I will talk about important topic about the medical education, which is called choosing the right future doctor as a new policy based on their characteristics. And thank you so much for inviting me. So, as you know, doctors are among the most trusted and professionals in society. So they make decisions that directly affect people's health and also people's safety and their lives. So, because of this, medical schools must carefully choose students who will become future doctors. So, why choosing the right doctors matters? So, because doctors directly affect patients, their health, their safety, and patients need trust and good communications. Technical knowledge alone is not enough, and society needs compassionate and also ethical doctors as well. So traditionally, medical schools mainly focus on grades and exam scores. However, being a successful doctors requires more than academic intelligence. They also need like empathy, communication skills, professionalism, and the emotional strength. So, in this conference, I'm going to talk about explain why personal characteristics should play a larger role in selecting future doctors and purpose balance admissions policy for choosing future doctors as their medical students. So traditional selection methods was basically based on like high GPA test scores, like MCAT scores, science and medical entrance exams, and they focus mainly on academic achievement, limited evaluations of personality traits. And the main problem was that excellent students may not always become excellent doctors. So choosing the right doctors is extremely important for society. Doctors interact with patients during difficult moments like illness, injury, emotional stress. So patients expect doctors not only to provide treatment but also to show compassion and also understanding. So a doctor basically who can communicate poorly may create like confusion or fear for patients as well. Like, or in other hand, a caring and empathetic doctor can help patients feel safe and supported. So basically today, healthcare system face many challenges like medical errors, burnouts, and lack of patient trust. And some of these problems are connected to poor communication, and we see that they are connected to weak interpersonal skills, which is really important. So this is why selecting the right students for medical school is critical, and medical school should focus on developing doctors who are not only knowledgeable but also humane and ethical as well. So which is really important. So as we see the key qualities needed in doctors, like one of them is empathy and compassion, communication skills, ethical behaviors, emotional intelligence, teamwork and leadership skills, and also stress management and resilience. So currently, most medical schools use traditional admission systems. These systems, as I mentioned, basically based on evaluating your high GPA, entrance exams, scientific and technical knowledge. But students compete intensely to achieve the highest academic performance. Academic ability is important, and this system has a limitation as well. So basically, a student may achieve excellent grades but still struggle with communication, teamwork, emotional control, and stress management. Some students may have like strong memorization skills but weak interpersonal abilities, which is really, really important in the medical field. This creates an important problem. Like excellent students do not always become excellent doctors. This is very important quote. And medicine is not only about like diagnosing diseases, it's also about the understanding the patients and making ethical decisions, working effectively with healthcare team. So therefore, they can rely on academic scores and also may not identify the best future doctor if they want to consider as a traditional, like choosing the students. And we see that based on research and evidence that we have empathetic doctor improve like patient satisfaction, good communication reduces medical mistakes, and emotional intelligence improve teamwork. Professional behavior leads to better health outcomes, and the example can be patients trusters who listen carefully and explain clearly as well. So the empathy and compassion is that doctors must understand patients' feelings and concerns. Patients often remember kindness more than medical terminology. And communication, doctors need to explain medical information clearly to patients and also families. And doctors should face difficult decisions and must always act responsibility and also honestly in this manner. So doctors should work under the pressure and then must control stress while remaining calm and professional. So teamwork is really essential. Modern healthcare requires like collaboration among different doctors, nurses, and also other specialists. So doctors need resilience and stress management skills because medicine can be emotionally and physically demanding. So these characteristics are just important as scientific knowledge as well. So as we see, the balanced selection system in the academic performance can be 50% for GPA, entrance exams, and scientific knowledge, and 50% we should put for the interviewing for personal characteristics based on situational judgment test, personality assessment, and voluntary experience as well. So research strongly suggests that importance of personal characteristic in medicine, and studies shows that the empathetic doctors improve patient satisfaction and the patients are more likely to trust doctors who listen carefully and show concerns. So, good communication can reduce medical mistakes. Miscommunication can lead to wrong treatment and misunderstanding about the medications as well. So, based on research, they show that emotional intelligence improve teamwork in the hospitals, and doctors who manage emotional effectively can work better with colleagues and patients. And professional behavior is another important factor. So students who demonstrate professionalism during training are more likely to become responsible doctors later in their career. So for example, when patients feel like respected and understood, they are more likely to follow medical advice and return for treatment when needed. So these evidence suggests that medical schools should evaluate both academically and also personal qualities during admissions as well. So we have how the new policy would work. The selection process can be academic screening, personalities assessment, structural interviews, teamwork activities, which is really important, final holistic evaluation, and the goal should be choose students who are both intelligent and caring, which is really important. So we are going to discuss the proposed new policy. The idea is to create a balanced admission system. Under this policy, academic performance would represent half of the evaluation and half the personal characteristic, which is going to be first GPA and then scientific knowledge, and then going to be the personality characteristic, which is really important. It should be half of the interview as well. So a situational judgment test present real life like medical situations, and also which is really important, and also the volunteer work can also show compassion, teamwork, and commitment to helping others. So this balanced system would allow medical schools to identify students who are both academically capable and emotionally prepared for medicine. So benefit of new policy is gonna be like better doctor-patient relationship, reduce medical errors or misunderstandings, and improve teamwork in hospital. More ethical healthcare professionals, increase public trust in healthcare systems. So students would complete academic screening based on their grades and exam, and then applicants uh, would take the structures and interviews based on those standardized questions and scoring system, and also they could participate in teamwork activities or group discussion. So this work help evaluating like leadership and collaboration skills as well. So they have like medical schools will use holistic evaluation process that combines our results together. So this approach can give them like more a complete picture of each applicant as well. So as we see, we have like challenges like subjective interviews, bias during selections, or increased cost, stuff like that we have. But this new policy could provide many benefits. It could improve doctor-patient relationship, could improve like strong communication, empathy skills, and trusted by patient. It can reduce medical errors, benefit from teamwork, and all those stuff that can have. So one challenge is that the interview may be subjective and different interviewers may judge student differently. So to solve this problem, schools can use standardized scoring system and trained evaluators. So another challenge, which is cost, so they can have additional assessment, may require more time and resources, and digital assessments and online interviews can reduce cost as well for both of the sides. And bias is another concern that interviewers may unintentionally favor certain students. So proper training and diverse evaluation panels can help reduce bias as well. So, and then finally, the process may become longer and more complex. So, combining online and in person methods can make the process more efficient. So, these challenges exist and they can be managed with careful like planning as well. So in conclusion, we have like future doctors and both need both like knowledge and also the characteristics. Personal qualities affect patients' care and safety, and medical schools should be balanced admission system, and compassion and professionalism are essential in medicine. So the best doctor treat patients with both skills and humanity. So current, like as I mentioned, admission system, they focus heavily on grades and exams, but these methods may overlook important human qualities. A balanced admission policy that evaluates both academic and personal can improve the patient care in future as well. So the medical school should aim to select students who are not only skilled but also caring and ethical as well. So thank you so much for listening. I would be happy to answer any questions if you have. Thank you.